And you can ask her, so how did you do it? What problems did you have? And you know what? She'd be more than willing to sit down, reach in the cafeteria, have what? Coffee. Good. And somebody's listening. And talk about it. So you're not out there all by yourself. And if you remember, let me see if this is working. Yeah. If you remember on the dashboard, there's a whole slew of you go straight, pick your initiative, go straight across, and you can go ahead and ask each and every one of those offices, how did you do this? By the time you're done with that, you've just done benchmarking, and it was relatively painless. Okay? So that was the goal there. And there's a thing that's called History Link. And History Link tells you how they've updated that page. Okay, so you can see there's a 2009 entry and there's a 2008 entry. And as time goes on, I took the screenshot before they did the 2010 update, so I apologize. I should have waited. That was too ancient. So there you have a little bit of information on how the different offices met certain knowledge management initiatives. Okay, everyone's going to talk at some point or another about a community practice. Every organization has its own definition, it's ours. But again, I talked to the people at Starbucks, in the cafeteria, whatever, and I said, you know, do me a favor, help me out here. Why should NRC even embark on a knowledge management program? And this is what they told me. Okay, so now they own it. It's theirs, not mine, it's theirs. So not only why should the agency spend the grand princely sum of $10,000 a year on it, but why should you, who the beleaguered, overworked, and underpaid staff, even be involved? Well, this is why. And again, these are answers that they came up with, not me. So I'm going to show you that we built, thank you, we built our knowledge center. I gotta have to really move here. So I'm just going to really go through these slides. We built a knowledge center, commercial off-the-shelf software. This is not SharePoint. Repeat after me. This is not SharePoint. A lot of people really love SharePoint. I hate it because it costs me an arm and a leg. Every time I want to do something, I have to hire somebody to fix it because our IT people can't do it. So we bought this really cheap piece of software that's just really fantastic, and we were really happy with it. And I'm just going to show you real quick. Well, you need to see that. This just shows you the 3 types of files that we have. If anybody's interested in this, come ask me. This is the policy paper that our agency endorsed. This sets up the infrastructure for the NRC's knowledge management program. It won't work for everybody, but if you want to see how one organization wrote it up, documented, and we actually re-endorsed it last Monday. We had an executive meeting, and we voted, and everybody said it's still okay, so I still have a job. That's good. It's publicly available. I can give you the link or whatever. The other files that we have, you know how people have terminal PowerPoint? Well, we have terminal PowerPoint, but we do it with audio. You can buy commercial off-the-shelf software, and you can put a little microphone in front on the speaker, and don't have to show the speaker, and the speaker can talk, and the software takes that audio, ties it to the slide, boom, you've got this really cool file. You can load it on your iPod, you can take it on a plane, and if you jump around from slide to slide, the audio jumps with you, which is really cool. We also have videos, and if we were live, I would have clicked on the link and you would have seen this video. And also, in the Knowledge Center, we ask people to put in their expertise in their own words, using terms that we're familiar with. For example, I can't even say, how do you say it? Fukushima? Yeah. So you would put that into your bio, and then if you wanted to find somebody, we actually found some people who spoke Japanese by searching through here for Japanese. In this one, we're searching for criticality in Germany, Don Carlson, and if you read underneath his bio, his picture, which of course is in super micro print, you'll see he's got his PhD in Germany. So he speaks German. So we can find people that way, and that is just so cool. I cannot tell you how helpful that was when the Japan event came about. Okay, so with all of that, now that whole Knowledge Center thing, we did it between 2008 and about August of 2009. We're about to do a major software upgrade. We're beta testing now. I can't tell you how cool it's going to be because it's going to build frequently asked questions automatically. It's going to, the conversations within the Knowledge Center. You know how people send email back and forth and you got to do an FOIA invitation forever because everybody's got to forgive. No. We do the emails through the Knowledge Center. They're threaded, they're captured, they're metadated, they're findable. And we're going to be able to push a button and print out the whole conversation. So if you need to FOIA, there's a one-button solution there, which is, I think, really cool. So that's coming. So what's the payoff? What's the benefit? After all this stuff of, I don't know, 3-4 years, and I feel like it's been 20, no. What's the payoff? We have enhanced mentoring. We actually have created communities of practice that are secure, and they're broken down by both function and also level in the organization. So there's an SES mentoring community. There's a branch chief mentoring community. There's a division director mentoring community, all of which are closed and only open to the people who belong to that community. Okay. There's also one for resident inspectors for all 103 nuclear power plants across the country. That they can share ideas, they can share whatever. But again, their managers can't see what's in there because it's not fair. It's for them, you know. So there's that, and enhanced mentoring is really cool. We're about to deploy something.
Who controls who gets in?
Pardon me?
Who controls who gets in?
The community leader or the chief editor. It's set up that way. You have to ask for permission to get membership in that community. Okay, so this is a tool that we're going to be deploying this summer. It was developed for the Army Leader Challenge. Very quickly, what it is it's experiential learning without experience. So this young man is going to tell you a story about something that came up, and then the video is going to stop, and you have to respond how you would handle that. Once you respond how you would handle that, you can see everybody else's response, and then you can discuss amongst yourselves, well, how did you handle it and why, blah, blah, blah. And then step 4, after all of that, you can see what the person really did and what the outcome was. It's really good for engaging people. New leaders, new resident inspectors, people who are afraid to talk. We can do one for that. I mean, what would you do? Like, you're not supposed to take questions until the end of the session. Somebody asks questions in the middle of the session, so what do you do? And this is how I handled it. We also now have an expert locator. I showed you the criticality in Germany. We found people who spoke Japanese. And now we also have empowered collaboration. Time for decision making has now been shortened. And one statistic I can tell you, and Maureen mentioned this before, is time to competency. This is what we save for $27 million. Instead of taking 24 months from a new hire coming in to stand for their oral board so I can send them out to do their job by themselves, it's now 18 months. We are a fee recovery agency. You can do the math, 22 days per month, 150 people per year, da-da-da-da-da. We're saving $27 million. And with that, I will get out of here. How do I get out of here? Okay. There you go. Thank you.
We are going to have time for questions and answers at the end. I want to get these folks through so that you have time to do that. Our next speaker is Reagan Tupp. Dr. Tupp is a public health analyst in the Office of Informatics and Information Resource Management for the Centers for Disease Control and Prevention. She leads the development of systems that collect, store, and organize public health knowledge and information from CDC partners, capture reach and impact of chronic disease program efforts, and demonstrates accountability for federal funds. She has over 10 years experience in qualitative research and managing practical program evaluations in community and federal settings. Very good.
Well, good evening, everybody. Wow. Oh, Patricia, so much energy. I love it. It's awesome.
It was pure fear.
Pure fear? Maureen, thank you so much for that introduction. And I'm so glad to have the opportunity to be here with you. I flew in from Atlanta, Georgia on yesterday, so I bring you greetings from Atlanta. Is there anyone else in here from Atlanta?
Still pretty
Yeah, there's a lot of person in here. But if you haven't been, we would love to have you come. Lots of good restaurants, dancing, music, and all good things to do after you finish with your knowledge management projects. This is actually my first time attending a knowledge management conference, and I have to say that I have been just thrilled and excited about the diverse amounts of information and varied interest from most people here. So I want to thank you again for inviting me. Today I'm going to talk to you about a knowledge management system that we are developing at the National Center for Chronic Disease Prevention at CDC. It's called the Chronic Disease Management Information System. I know that's a mouthful, so throughout today's presentation you'll hear me refer to it as CIDMIS. That is a name that our state grantees actually adopted and fell in love with. It's Greek for something, I'm not sure, but we will be using the term CIDMIS throughout the presentation. As Patricia mentioned before, there are lots of definitions for knowledge management. So I won't talk to you about that today, as I'm sure most of you are familiar with what that is, but I do want to talk to you about how we've collected and cataloged and integrated information in our organization. I also want to bring to your attention 4 organizational characteristics that was really helpful to our team as we were developing the system. One of the things that we always try to keep in consideration is the context that we're in. Because the information that we gather is not useful unless it's within context. So I think that we have some very unique challenges in the public health field that I want to talk about today. And I was in a leadership meeting on last week, and the presenter introduced this acronym, VUCA. So I'm sure most of you are familiar with it and have heard it today. But for those of you who haven't, VUCA is for volatility, uncertainty, complexity, and ambiguity. And I think it really reflects the public health context we're in. As far as volatility, there's so many disasters and increases in gas prices that are going on right now. The uncertainty of what's actually going to happen with our government organizations. If you're like me, about a month ago, we were actually faced with a pending budget shutdown or government shutdown, which was really scary. The complexity of how to move forward, and also the ambiguity about how to organize ourselves to move forward. This is the context that we're living in, and something that makes developing knowledge management systems really interesting, to say the least. One of these emerging public health problems that we also have is healthcare, and then also chronic diseases that, for the most part, we're spending most of our healthcare monies on. In fact, we're spending 75% of our healthcare spending on those who suffer from chronic disease. And so to develop these new technologies, the complexity of the public health environment, we have to consider these types of things. It can be really overwhelming and discouraging. Like, I don't have money, my budgets are cut, how am I going to develop the system with limited resources? And so while it can be discouraging, our center has actually taken a very optimistic outlook on all of this and have decided to engage in this process anyway. We've kind of grabbed the bull by the horns and decided to promote health and well-being, which is what is a really critical part of our mission. And we do that under the direction of Dr. Ursula Bauer at the center. We also have 9 divisions that help us engage in these activities focused on adolescent and school health, topics like diabetes, nutrition, reproductive health, and heart disease and stroke. Each of these divisions is engaged in several different program activities related to public health surveillance, developing tools and resources for our stakeholders, translating the research that we find through our surveillance activities and other research activities at CDC so that our grantees can implement these programs in their states, communities, and tribes.